one of the symptoms of sleep apnea is that people are too tired and they're often exhausted, and they might fall asleep at a stoplight, or worse, fall asleep while they're driving. They could just doze off at other times of the day when they're not intending to, and they just know they're having hard. Sometimes people don't feel that bad if they have a milder case of sleep apnea. Sometimes if they have a more severe case, they know they just feel terrible every day. So there's kind of a continuum, a spectrum of levels that people have, but it's very important to treat it even when you have a milder case, because what can happen, the dangers of it, is that untreated sleep apnea is going to lead to hypertension. It's going to lead to cardiovascular disease. It has been linked with the onset of type 2 diabetes. It has been linked with stroke. It's been linked with a lot of terrible systemic effects that people don't want in their lives. And in fact, it's been proven that treating obstructive sleep apnea can extend somebody's life by 7 to 10 years. So it's a very significant thing for people to consider. And the problem is that the vast majority of people in this country and in this world are undiagnosed. They're undiagnosed. They may think that they may not be so severe that they really are in the sleep doctor's office saying, "Hey, what's wrong with me?" But they may not feel great. They may have a milder case of it, and yet if they don't treat it, those systemic effects are going to occur given enough time. So that's why it's important to get tested if you do show signs and symptoms, and/or at our office we use a screener, which actually helps to assess in the patient's own assessment of their sleepiness, and also some physical markers to try to ascertain if the person has a high likelihood of having sleep apnea. And so we talk with you about that if we find that to be the case, and decide if getting tested is the right thing for you.